going to jump right into a slide presentation that will be available to you after I afterwards, so that you can go back over and collect those nuggets. And if there's pieces that you missed, each of the slides can stand independently. So think of me as a tour guide, and I'm going to jump right in and say I was at an elementary school today, and it was already report card time. And I want us to think of our presentation tonight like that. What is the state of your state? If you had to give your state a grade when it comes to HPV vaccination, clinical screenings, pap smears, where would your state fall? That's the nature of our presentation tonight. And again, I'll be giving you lots of tips and tricks and even showing you some of your own state data. I'm Tracy, by the way, and I'm the co-leader of the Oklahoma chapter. Now, remember, you had homework. Whether you got very far within it or whether you just scratched the surface, I want you to take out that sheet. A screenshot is over here on the right, so it kind of looks like this. Each of these prompts is a building block for you to create a resource guide. If your chapter does not currently have one, you could pick among these like a menu and find one that really works for the mission of your chapter. Or if you're aspirational and want to invest some time, you could use each of these to make really a custom chapter information tool for your chapter and for your state or the community that you're working in. I find that resource guides like these are really helpful for my chapter when Emily and I are networking with others, when we're connecting with groups and organizations that have similar goals, or there's been times that we've done resource guides for the folks that we are engaging with, like the question or bullet or prompt number 2 here, like if you're going to locate your free or low cost pap smears in your state, again, you can develop that out and polish that out to be its own resource sheet in and of itself. By the way, the last prompt is going to be really useful for later conversations, especially if you're needing support for your chapter or other chapter leaders, if you want to get together and brainstorm how you can develop more opportunities in the communities that you're trying to serve. We're going to focus at the very top, the state of the state. And on your homework, you were asked to Google cervical cancer statistics by state and start jotting down some notes. And again, you may already have a good handle on this, but sometimes math's confusing and sometimes it's just hard to find these data. What I find, though, really is knowing the state of your state helps your chapter so much. It's going to help you educate and communicate. It's going to support donation requests. It's going to establish the need. It's going to encourage healthcare provider conversations. It'll help you elevate your message when you have the data to support all the great work that you're doing. For us in Oklahoma, we're failing. We're an F. So we use the state of our state to help communicate the need and the risk, and also to prompt the folks that we're engaging with to have more urgency to take action and to follow up. So again, these resource sheets that we have and knowing the state of your state really helps your chapter build credibility, even in your social media presence. And again, for tonight's purposes, I hope that I can inspire as well as show you some tips to help you, again, just because I love you. I want to help you validate your work and your passion and our joint mission. But knowing the state of your state can also be pretty disparaging, especially from a state like Oklahoma, where the need is so great for HPV and cervical cancer awareness. Here's how we'll do this evening. We're going to go virtually, and I'm going to show you some maps of the US where you'll literally see like the state of your state. There are going to be some comparison maps. I'll also have select websites provided so that you on your own time, if I spark your interest, you can go back and then click those links and then put in your state to pull that information. At the very end, you'll also have some detective tips and tricks. I let those at the end, though, in case I go over time. You can still access that after our time is done. Here's a quick tip to start us off, and that is when you're trying to find the state of your state, some of the graphs and maps and all of those charts are sometimes a couple years old, and that's completely okay. It takes a while for data to get compiled, compressed, collected, so you won't find 2025 data, of course, but honestly, you might not find 2024 data either. And again, that's okay. Just a sweet reminder, when you do find a website that has great information and is really user-friendly, jot that down, but also give them credit. We want to make sure that we're citing that information source because data will, of course, change and get updated. And that way you can go back and find the most current state of the state next year. Let's go ahead and jump to see the state of your state. This might mean that I need to stop a screen share and then re-screen share, so thanks for being patient. Hopefully you can see my slide right here. This is our HPV vaccination rates as of 2022, and this is from the Kaiser Family Foundation. Again, that'll be linked later for you. Over in the right-hand corner, you'll notice that we have a key or an index of your estimated vaccine rates. And many of our states are, well, again, like a report card, we're failing. The purple states down here are failing. And pardon me, I don't know everyone's state that is being represented here, but I remember a few. So California, you're in the green. Virginia, all of us can do this. And if you notice the percentages here, again, if you're not too mathy or not sure how to communicate this to your target audience or your priority populations, you can always simply use comparisons, right? You can compare your state to other states or to the nation. So how I do it for Oklahoma, since I've already given you a hint, since Oklahoma is failing, I say that we are less than the US average as far as our vaccination series. And that would be true for many of the states that we have here on this particular slide. I'm going to go to another slide. Hopefully you were able to identify where your state is on this one, but let's go again and keep looking at state of the state. This is the rate of new HPV-associated cancers in the US. And what I did here was take a screenshot, and I know it's a lot of information, a lot of bars, but if you're on this particular slide, that means that your state has higher rates of new HPV-associated cancers compared to the US average. Once again, remember, I've got this link on the slide so you can go back and find your state if it's not on the list. I told you, Oklahoma isn't doing too great. But what about your state? If you notice, many of the states here have above the US average, don't they? So how I would communicate this if I were speaking with someone, again, this is going to help me say in comparison to the US, I'm within 20 or so other states that really need attention. We need more screening, we need more advocacy, we need more work done, right? Let's go to another one. I hope my pacing is well enough so that everyone can take a couple notes, especially if they're seeing their state on the chart. Remember, when we're talking about state of the state, maybe when you were Googling, you found a lot of data or statistics, and you weren't quite sure what some of those percentages and numbers mean. I have a quick, easy tip, and that is focus on the message, not just the math part of it, right? Think about it. If we're focusing on messages, we can use comparison language and really effectively communicate more than just a number alone. So I've been saying this for my state, and you could practice it even with the information that you found for yours. You could say, my state is worse or better, or higher or lower, et cetera, et cetera. I'll show you some examples on the next slide. My state is worse than other states in teen HPV vaccination. I've looked at the state of my state, and that's, a fact for me. And that's really impacting when I'm talking to college students, when I'm talking to moms of adolescents. My state ranks, and again, you would just fill in the blank here, higher or lower than other states in cervical cancer deaths. I'll leave this here for a second since this is the first time that you've seen it. But when you did your homework, hopefully you were able to get a little bit of information about your state and start thinking to yourself, how do you compare? And how would you translate that message into something that's really meaningful for the folks that you're working with? I think for the third one here, for my state, we have less cervical cancer screenings than most of the country. So this right here would be something that could really empower me to approach funders or donors to help get more free clinics and more access to cervical cancer screenings. And again, there's another one here just for another like prompt for us. My state has increased or decreased HPV rates in the past 5 years. Some of you I know and have admired that you work very intimately with specific communities. And if that's the case, the language prompt simply changes to my community or my city has higher or lower cervical cancer rates, for example, among women of color. I know in my particular area, if you are Native American, American Indian, or Hispanic in the Tulsa area, these numbers are off the charts and very hard to measure sometimes because we have a population that moves from one area to another, and also a population that is fearful of going to the clinic if they are not documented. So again, we know that these rates are higher, but we also have a problem. Now remember, I love to talk, so thanks again for being so awesome to me to let me have this time. But remember I said this is like a report card, and a report card is our opportunity with our children to show where we can improve, or maybe areas that we want to focus. So again, I'm not asking you to prescribe the language to your chapter. You know your chapter better than anyone. But as you're developing it out, you can see the thought process here. As you know the state of your state better, it really positions you and elevates your message so very much. The CDC has data for us. And of course, the CDC is ginormous. So that makes it sometimes tricky to find the information. You're linked up here when you go back on your own time. I have a screenshot here on the left, which is if you did it right and you click that link, the page that you'll land on. I'm going to show you now together. But again, I think I'm going to need to stop my screen share in order to advance. So give me just a second. Thanks for your patience. And hopefully this is going to pull up your CDC page. Could someone give a thumbs up if you see the US cancer statistics? That would help me know that everything's cameraed up.
You're good.
Oh, thank you. Thank you.
You're welcome.
Oh, thanks. This is our US cancer statistics. Now, again, tips and tricks are on that, on the PowerPoint. But remember, if you go right here in the middle to female, you can change this right over to cervix right here. And this will help you for 2021 know your state of the state. So I'll just leave it here for a second so you can take this information in. This gives us a rate and a key at the bottom. So let's look at that one more time. The rate of new cancers. So we want this number to be low, but what we have is a lot of these states down here in the dark blue. That means there's a problem. That's showing us that those areas have much more than the rest of the country. And if you notice that West Virginia is included in this, as well as Kentucky. So again, when we think about the state of your state, here's another really quick and accessible resource for you. Again, the Centers for Disease Control. And this is helping me know again that my state is failing when it comes to the rate of cervical cancer. Again, we're doing worse than other states. And again, I can see several other states. Virginia, it looks like Virginia, there you are. Who else do we have tonight? We've got California. Lots of the numbers that you see, let me just hold on Texas for a second. Lots of the numbers you see may not be in your wheelhouse. So let me just speak to that for a second. If you notice here, it says like 9.6 per 100,000 women, and then this 95% confidence interval. Those, again, for folks that aren't not statistically savvy, can be overwhelming. And most of the people that I engage with in my community at health fairs, they really wouldn't understand those numbers. That's why I've been emphasizing our comparison messages to say again that my state is worse or better, or my state needs improvement compared to others. But those numbers do, by the way, adjust. They do adjust for the differences in the sizes of our states, because it wouldn't make sense to compare Texas to, say, I don't know, like Maryland, right? But all of those are factored in. So this gives you a good representation here of the rates, and hopefully you're able to jot down where your state is. This CDC website allows you to change the cervix, and we can see a menu here. We can look at ovarian cancers as well. There's many different menus, and you can also sort by other health conditions if that happens to be interesting to you. I'm going to close this. Sorry for the clunkiness, but by me stopping that screen share, then I can go to the next one that's on our slides. Thank you so much for being patient with me. Zoom is notorious for not liking screen shares. So now we're going to go to another one, and I will be sharing my screening with the Kaiser Family Foundation. And here is another map, again, that'll allow us all to see the state of our state. And this is cervical cancer incidence rate. So again, this is a comparison map that you'll have a link to. And as we look here at numbers, the darker the blue, the worse off that your state is. And it's very disparaging. Many of our states are failing. Many of our states need all the work that you're doing. So if you look, we definitely see those patterns again, don't we? We see all of the South here. We see West Virginia and Kentucky kind of pulling south, showing similar. What I don't have for you tonight are the answers as to why all of this is happening. I don't know. If we do our work as we are, maybe we will work ourselves, so to speak, out of NCCC. But as it is for this particular map with KFF, again, cervical incidence rates, these rates are higher than what we would want. Even your deeper navy blue here, New Mexico and Kansas, some of these states, again, are really struggling. Thank you so much. We have a few more to look at. I hope I'm doing moderately here on time so that you're still getting some notes for the state of your state, but also realizing there are certain websites that have done some of this investigating for you. I'm going to ask if I can just stop that screen share. And now we're going to go back again to that PowerPoint. And if you can see the PowerPoint, that would be great if you would give me a thumbs up or a high five. Okay, thank you for that. So here we did the CDC visuals. This one is a complex one. Again, it's linked up for you, so it's not necessary for me to speak over all of it. But this one has a cervical cancer data dashboard. You can filter by your state. What this one, if you're making a note, if you'd flatter me, this one right here is really interesting because you can find county-specific data. And this one, I'm not going to say it's over my head, but this one, again, is very dense. So as you go in, be prepared. It even takes a while to load this up. But it's really interesting to see cervical cancer surveillance data, not just for your state, but for the communities within your state. That, for me, was really not too surprising. Most of my state is very remote or rural. Hard for me to say. I'm originally from Virginia. And our rural communities have different access to healthcare and screenings and follow-up. And so that on my map is really, really evident. And it makes me very proud that I'm doing the work in the Tulsa and OKC area, but it means that there's a lot more work to be done in the outskirts around our state lines. Here's another one. This is kff.org. we can we kind of went there already and I showed you some. This will allow you to choose a map if you are very visually stimulated by these. If you notice on the screenshot, I'm going to wiggle my mouse right here on the left. You also have tables if your brain works better by tables. Again, you can do state specific, you can filter it by cancer statistics, women's health, another great resource for your pocket. I want to close with a few more slides again, just to just kick us off tonight. Thank you again for all the work you're doing, but don't forget this. Your state knows the state of your state. And if you didn't realize that before, I hope that I am really blessing someone in this quick presentation of mine. Try to locate online your state's health report. Remember, you won't have one for 2025, right? You won't have one probably ready for 2024, but you should be able to find a 22 or 23 state health report. This is going to be a thick, dense PDF document, but you will absolutely be able to find women's reproductive health within that, including cancers, prevention, screening efforts. They may also have specific web pages for STI prevention programs, screenings. You may even be able to see if there are specific numbers being reported for HPV-related cancers for your state. So again, when you think of the state, try to find your state's own health report. Remember I said at the start of our presentation, kind of like a report card, there was kind of a pun intended there, so you'd remember that. I find mine to be very thick, but it leaves me very much questioning why and how come, and what more can our state do, especially since my state is struggling. By the way, your state or local health department may also have an office that specializes in women's health and women's sexual or reproductive health and current programs that are in place. It's just a matter of finding the right office. I recognize for the sake of time, I can't hear all of your great ideas and we can't have all of your great sharing opportunities right this second. But again, this message is addressed for someone who's maybe a new chapter leader or hasn't tapped into this resource before. The lady who is in charge of my state office saw me at a conference one time, and now she is going to partner with me and Emily for a end of January presentation where she's going to come on like a webinar style and tell what the state is doing and give us a state of the state report. And it was so amazing to me that I didn't even realize I was doing something right. I was just at a conference and she saw the teal and knew that was my passion. But she was an infectious disease prevention coordinator, and I'm really happy to tap into that. So my point is, you likely have someone that's sitting at an office Monday through Friday who may be able to provide some of the state information for you, and that would be so amazing for them to be a partner for you and a support system. Here's another quick idea, please, and I think that I'm getting close to time. Some of states are going to have a Medicaid breast and cervical cancer treatment program. Here is one of the acronyms that I've seen. Each state might have a pet name for it. The eligibility for services varies by state, but this already is
Yeah.
a great resource. It's a very good resource for you as far as knowing how to get diagnosis, follow-up, treatment, and they may have community health workers or community health educators that are doing projects in your area, and they may need you to come along and have a table there, right? Or do some sort of NCC outreach at one of their programs that's trying to destigmatize STIs or trying to make sure that cervical cancer follow-up is being done. So again, your state knows the state of your state. And I hope that I have given you some tools and tips and tricks to help you find the state of your state as well. I personally want to thank you for all you do. I feel like I landed at NCCC at a perfect time to grow and to learn from each of you. Knowing the state of your state is so helpful. And you're already improving the state of your state in your chapter. You're educating, you're raising awareness, you're networking and problem solving, you're providing care packages, you're supporting women and their families. And I sincerely hope if you were to run back through the slides that it'll be helpful. Behind these slides are some extra tips and tricks if you have had some trouble finding the state of the state data. I think I've put some guides on there that might just help it be more tangible for you. I appreciate you, Rena. I'm going to pass the mic back over to you this evening, and I'm available if someone had a comment or question, and if not, that's okay too.